Hello class. Today I discuss about oxytocin. So the oxytocin is a endocrine hormone. This source of secreted mainly by paraventricular nucleus and partially supraoptic nucleus, transported from hypothalamus to posterior pituitary through the nerve fiber of hypothalamo-hypophyseal tract. In the posterior pituitary, the oxytocin is stored in the nerve ending of hypothalamo-hypophyseal tract. When suitable stimuli release the posterior pituitary from hypothalamus, oxytocin is secreted in both male and females. Chemistry and half-life of oxytocin. Oxytocin is polypeptide having 9 amino acids. It has half-life of about 6 minutes. Action. Oxytocin action mainly on mammary gland, milk let down, milk ejection reflex, and second is on uterus. Action on mammary gland causes ejection of milk from the mammary gland. Oxytocin causes contraction of the myoepithelial cell and flow of milk from the alveoli of mammary gland to the anterior through duct system and nipple. The process by which the milk is ejected from alveoli of mammary gland is called milk ejection reflex or milk letdown reflex. It is one of the neuroendocrine reflex, as this reflex is initiated by the nerve factors and completed by the hormonal action. It is called neuroendocrine reflex. During this reflex, larger amount of oxytocin is released by positive feedback mechanism. Action on uterus. Oxytocin act on pregnant uterus and non-pregnant uterus. Pregnant uterus. Throughout the period of pregnancy, oxytocin secretion is inhibited by the estrogen and progesterone. And the end of pregnancy, the secretion of these two hormones decrease and secretion of oxytocin is increased. Oxytocin cause contraction of uterus and help in the expulsion of fetus. It is also an example of neuroendocrine reflex and positive feedback mechanism. Non-pregnant uterus. Action of oxytocin on non-pregnant uterus. It is to facilitate the transport of sperm through the female genitalia tract up to the fallopian tube by producing the uterine contraction during sexual intercourse. Action in male. Release of the oxytocin increase during ejaculation. It facilitates release of sperm into urethra by causing contraction of smooth muscle fiber is reproductive tract, particularly vas deferens.